Sodium is an important ingredient when looking at nutrition labels. You may know sodium as salt that is added to foods. It contributes to several important functions of the body. Sodium is critical in maintaining fluid balance in the body, as well as sending electrical signals up and down the neurons. It's also involved in muscle contractions and in digestion, especially when breaking down nutrients like iron and vitamin B12. Sodium is also important in maintaining your blood pressure. Sodium attracts water to it in your body. If you have normal sodium levels in your body, you will also have water in your blood vessels, increasing the blood pressure. If your blood pressure gets too low, you may run the risk of passing out and not getting needed nutrients to your body. If your blood pressure is too high, you risk damaging blood vessels, which can lead to strokes, heart attacks, heart failure, and kidney disease. Getting the right amount of sodium is essential for the many functions your body needs to survive. You can find sodium listed on the nutrition label. The Food and Drug Administration recommends limiting sodium intake to less than 2,300 milligrams per day for most adults. On the label, you'll notice sodium is listed both in milligrams and as a percent daily value, or percent DV. This tells you how much one serving of that food contributes toward your daily limit. As a good rule of thumb, 5% DV or less is considered low in sodium, while 20% DV or more is considered high. A simple way to put this into practice is by comparing foods side by side. A canned soup might contain 800 to 900 milligrams of sodium in just one serving, which is nearly 40% of your daily limit. On the other hand, fresh vegetables or fruits may naturally contain very little sodium. Looking at the numbers helps you see how quickly sodium can add up throughout the day. Another tip to keep in mind is that sodium doesn't just come from the obvious salty snacks like chips or pretzels. It often hides in everyday foods such as breads, sauces, salad dressings, and frozen meals. Checking labels gives you the power to make smarter swaps, like choosing low-sodium broth instead of regular, or fresh poultry instead of processed deli meats. These small decisions spread across the day can make a big difference. Using the nutrition label is especially important when caring for patients with conditions such as hypertension, kidney disease, or heart failure. For these patients, monitoring sodium intake is part of their medical treatment plan. Too much sodium can worsen fluid retention, raise blood pressure, and increase the workload on the heart and kidneys. As a nurse, being able to interpret a nutrition label not only helps you educate patients about food choices, but also reinforces how diet directly ties into disease management and overall health outcomes. Let's look at the types of fats found in foods. There are 3 types of fats: saturated fats, unsaturated fats, and trans fats. Let's start our discussion with unsaturated fats. These fats are generally considered healthy fats. They can be broken down into monounsaturated fats and polyunsaturated fats. This refers to the number of double bonds found in the fats. Monounsaturated fats have only one double bond found in their chemical structure. Foods high in monounsaturated fats include olive oil, avocados, canola oil, and most nuts like almonds and cashews. These fats help reduce bad cholesterol or LDL cholesterol, support healthy cell function, and may improve blood sugar control. Polyunsaturated fats have 2 or more double bonds in their chemical structure. You may be able to tell that they are polyunsaturated because they tend to stay liquid at room temperature. This type of fat is found in sunflower, corn, soybean, and flaxseed oils. In addition, they will be found in walnuts, flaxseed, and fish. Unsaturated fats are generally considered healthy fats. Eating fats from this category can reduce cholesterol, reduce inflammation, and help with heart rhythms. Eating this type of fat can be protective to your heart health. Now let's turn our attention to saturated fats. Unlike unsaturated fats, saturated fats have no double bonds between the carbon atoms in their chemical structure. This means the carbon chain is saturated with hydrogen atoms. Because of this, saturated fats tend to be solid at room temperature. Common examples include butter, lard, and fats found in fatty cuts of meat, as well as tropical oils such as coconut and palm oil. Saturated fats serve several functions in the body. Like all fats, they provide 9 calories per gram, supplying energy. They also contribute to protecting organs by providing cushioning and help insulate the body to maintain temperature. Additionally, Saturated fats play a role in hormone production and are part of cell membranes, though their impact on cholesterol and heart health differs from unsaturated fats. While the body needs some saturated fat, eating too much can raise levels of LDL cholesterol, often called bad cholesterol, which is linked to increased risk of heart disease. That's why nutrition guidelines encourage limiting saturated fat intake and replacing it with healthier fats, such as the unsaturated fats we discussed earlier. Balance and moderation are key when it comes to saturated fats in your diet. Let's finish our fat discussion with trans fats. Trans fats are a type of unsaturated fat, but they are quite different from the healthy unsaturated fats we talked about. Their chemical structure includes a trans double bond, meaning the hydrogen atoms are on opposite sides of the carbon-carbon double bond. This makes the fat molecule straighter and more solid at room temperature, similar to saturated fats. These types of fats are made by taking vegetable oils and heating them up in the presence of hydrogen. This process is artificial and takes a liquid fat and turns it into a solid fat. This process was widely used because it increases shelf life and stability of processed foods, making products like margarine, baked goods, fried snacks, and fast food more convenient and less likely to spoil. Unfortunately, trans fats are linked to serious health risks. Trans fats raise bad LDL cholesterol and lower good HDL cholesterol, which increases the risk for heart disease and stroke. They also promote inflammation and have been associated with higher risks of diabetes and other chronic illnesses. Because of these dangers, many countries have banned or strictly limited trans fats in foods, and health experts strongly recommend avoiding them as much as possible. Now, when looking at a nutrition label, you will know what to look for when comparing the foods you eat and how fat impacts your overall health when making those important decisions.